Hello, friends. Welcome to our podcast, Learning Matters. Today, we are here to talk about adolescent mental health and their well being. I have with me Neena David today. Thank you for joining us this morning.
Thank you, Monila, and thank you to the Teacher Foundation for having me over.
Hashtag back to school. When the schools reopened, the internet had maximum posts about what a joyous thing it was. Of course, children going back to school, but also what back to school really means for school goers as well as for adults.
Right.
What do you think, Neena, now it entails, as our young people are coming back to school, coming back to these spaces and are going to be in physical proximity to each other. So any suggestions, any pointers from your end?
Right. I think a good rule of thumb is to meet the children and adolescents where they are. If we're coming from that space, then we're ready to acknowledge that there are gaps, there are deficits. And rather than, wringing our hands about, there is this gap, there is this deficit, how are they going to cope? We just understand that this is universal, right? If we're going by UNICEF figures, there are 1.5 billion children and young adults on this planet who have been affected by the pandemic. So that is a sizable number of the world's population, right? So if we can just acknowledge that, yes, there are deficits and we need to meet them where they are and then begin from there, right? There are certain things that students have been able to preserve, especially those who did have high quality access to digital tech. But for students who were not able to access this, where we saw so many inequities in terms of digital access, those have been students and adolescents who have been the most hit in terms of academic difficulties because they were not able to access the curriculum in ways that were meaningful at all, right? So I think in a classroom, we also have to be sensitive then to these groups of students, because it may not be that everybody needs the same kind of attention and quality of care. But students who were particularly disadvantaged, I think those are the ones who would need a lot more attention. Students who had diagnosed learning difficulties or attention-related difficulties, or were coming in from families where there was a lot of dysfunction, even just at a familiar level, those are going to be groups that are going to need a lot more attention and care. So one thing that we've worked with teachers is also just looking at when students come back, the need for them to feel a sense of belonging and safety in these spaces is going to be at the topmost. You have to make that your goal before you move with other academic areas of requirement, right? So the child needs to feel connected, feel a sense of belonging, because once that psychological aspect has been met, the learning follows. It's not something that we have to labor over simply because the child is in a receptive space with what's there. But attending to these aspects of belonging, of connectedness, and of safety in spaces has meant that we need to stay intentional with it and not feel like, okay, children are back, they are just going to automatically slip into these spaces. I think our radar has to be tuned in to picking up on some of these distress little signals that are popping up, because they can be muted at times or they can be a little quieter, but it's definitely there. Children are struggling to find their spaces back, and it helps that they have a supportive adult who lets them know that they do belong here and that this is a safe space and we are connected, because that is something that was absent in their 2 years. And so this is a whole new planet almost for them to get back into and reacclimatize.
Yes.
So yes, I would think maybe that's what I would prioritize for educators and for parents as well.
Yes. And finding the time and opportunity to really have conversations, keep conversations going and keep oneself connected with their lives. And these conversations, yes, one is to have scheduled conversations, in your timetables, something like, what the Teacher Foundation has been really helping schools implement for past 20 years, quality circle time, which is like a scheduled timetable time to have a conversation. But even otherwise, Neena, what I have observed or I have felt is that, unfortunately, we begin to talk about these difficult aspects of growing up only when there are some very drastic events, such as a suicide or a crime, or some loss of grave nature. But there isn't this culture of conversations that is being carried out. And therefore, I mean, if you could help us with some suggestions, to keep conversations with young people really going. How do we stay connected with their lives, especially for parents, for teachers, for all the adults who in some capacity are working with adolescents, with the young population.
That's so absolutely spot on, Monila, in terms of recognizing that we don't really have cultures that engage with young adults or with adolescents and children in meaningful ways. That at most times it is a firefighting response that we're able to demonstrate. And whenever we, put out these very knee-jerk responses to crisis situations, then we have just dealt with that particular crisis. We have not looked at strengthening structures or systems in any way. So yes, I believe that there is space for sure for nurturing those cultures of conversation, and especially now because if we're just looking at the research that's coming in, and I've been particularly interested in looking at what has made digital learning successful for some students, what were the factors that helped, and the big thing that's coming there is social connections. So if a teacher in the class was able to create a certain level of connection, and it could be that it was that we're wearing maybe a silly costume on that morning, or we did something funny on our like face masks and we took like a screenshot, or we just sat down and we opened our dabbas in front of the screen and we did our lunchtime together, right? Or we brought in a pet and we introduced the pet to the class online. We opened up some part of our worlds to one another and we created those links of connection. Those were classes where learning happened, where children belonged and they connected because it opened up conversations. And more than meeting learning objectives, I find that being able to feel like this is something that we need to do, more importantly, if that drives it, I think it's really a belief in it. If I believe in it, I'm going to make it happen. I'm going to create the time for it. So there are some teachers who, after the pandemic and when we're back, are just looking at what things worked for me in the classroom and what are some of those things that I would like to continue. And one of the big things that came up was just this, how we connected with one another and making it intentional. And so I do feel like conversations then probably have to be scheduled given the busyness of our lives. Which means that schools and families have to just say, okay, Wednesday night is this, Sunday night is something else. We're scheduling it. Now, if and beyond that, there are things that are happening, that's like a bonus.
And even if you're scheduling it, bringing in your authenticity, and not doing it because it is simply because
Right.
it is on the
It's required.
schedule.
It's on time. So, it's 10 o'clock. Let's start
Yes,
talking.
yes,
Because with this population, and I've just finished, writing up an article for a pediatric journal saying that you may want to communicate, right?
yeah.
But the adolescent may not. So,
Hmm.
to even just recognize that communication is not happening on your timetable,
Hmm.
this is an age group that is going to shift its needs of communicating with you as the adult to the peer group, but it still
Yes,
means that they need you in some way.
yes,
So
yes,
being available, being present for those conversations, just turning up for them, being able to listen to what they have to say, I think is just so crucial at this point in time.
yes. So, just my last question, which is something that struck me from my conversation with a friend of mine who has an adolescent child, and how she and her husband, along with their child, seek support from a counselor, from a psychologist during the pandemic, because they just found it very difficult to have a conversation, and they started feeling that there was like this loss of connect with their own child in the same house, and as you said, that you might want to communicate, but that is not the felt need of the child at that time. So my question to you is, now, there are parents like these who did it, or maybe there are also teachers who seek extra support. But what have you observed, Neena, in terms of help seeking behavior, from adults and from communities who work with young people, because it was always, even in pre-pandemic days, it was always low. A lot of conditions went undiagnosed, and there was always resistance in seeking help. Have there been shifts? What has been your experience there?
Right, right. If I were just going by the hours of work that we've had to spend in these 2.5 years, and without a break, almost 13, 14 hours that we're plugging in as a team every day, I would say yes, there has been a shift in terms of children, adolescents, and families and educators feeling that they can reach out and ask for
Mm,
help, right? So there has
mm,
been that shift, definitely, that has happened. um, Having said that, though, I don't know to what extent we're going to see this as a permanent shift. I
mm.
don't know whether this is something that we're responding to because in the moment, this is
Mm.
how we're feeling, right? It's
Yes.
like I would pray to God only if I have an exam. Yeah,
Mm,
it's that kind of situation.
mm,
So I'm
mm.
coming and
Yes.
accessing help because I need this. But working it or embedding this in terms
Mm,
of more structural and systemic requirements that there are certain things that we can do or that help seeking is all right, that we lower the sense of stigma that we associate with this. That is something that I feel still needs to be worked on.
mm,
So I see the trend in terms of the shift. I'm just not aware of to what degree it continues.
mm,
We can stay hopeful with
mm.
the possibilities that once students or families get a sense of what it is to really seek help, a lot of those misconceptions and myths about seeking help are also blown apart, and so
Yes.
therefore it
Yes.
may pave the way for future such reaction in interactions.
Mm,
um, there's also a whole bunch of stuff online.
mm,
Not all of it is coming from professional spaces in terms of mental health and taking care of it.
mm,
The sense that I can put on a face mask and sip a glass of chamomile tea and my well-being is going to be met is also sometimes the idea that is propounded, right? So you will hear a lot of the me time, the self-care, and all
mm,
of that. And yes, while some of it may help you feel better for a bit,
mm.
it is also the sense of putting in things that are perhaps going to sustain you over
Yes.
time.
Yes.
And I'm specifically referring to resilience and
Mm,
coping structures and what we're equipping
mm,
ourselves with, because this is definitely not the first of many.
mm,
Uh, you know, untoward incidents that we're going to be witnessing. There is much more coming. So, in what ways are we creating those levels of resilience? Also, something that I'm hoping that these conversations are moving towards, besides just, immediate short-term well-being and keep yourself positive kind of discussions.
Yes. Thank you, Neena. So on that very hopeful note, I would like to bring this conversation to a closure for today. And I would like to really reach out to my listeners, to my friends, and help them know that there is help available, and to continue with this culture of seeking help, or culture of having conversations, culture of staying connected, no matter what. Even though the pandemic sort of kind of pushed us into this, and as you said, it was our response to something very, very extreme in our lives. But maybe continue, maybe hold on to these structures, and perhaps even refine them further, to in a very sustainable way, as you say, Neena, to see to it that we are providing the much required support to our young people and to everybody who works with them. So on that note, thank you so much, Neena, for your time, for sharing your insights from your rich experience. And it was wonderful to chat with you this morning. So thanks so much for that.
Thank you, Monila. That has been an engaging morning. So thank you so much for having me over. And I'm just hoping for viewers or listeners out there, that sense of continuing to engage in conversations is something that they're taking from these experiences that we've had.
Thank you. Thanks, everyone. And in case you need any support, any help while working with young people, working in schools, do feel free to reach out to us, the Teacher Foundation. The details are provided, and we really look forward to helping you and supporting you in every way possible. Thanks so much.